Hey guys, welcome to our daily practice questions. As always, I like to get into my intro and disclaimer. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide nurses and nurse practitioners with tools, resources, courses, and videos to assist with success on boards as well as in practice. I've been doing this since 2015, helping nurses and nurse practitioners internationally with exam success with a 99% pass rate on our full course and 100% pass rate with our one-on-one sessions. I look forward to work with you guys, but I always like to get into my disclaimer before we get into our material for today. So, y'all know that there's no absolutes in medicines. We treat on a patient by patient basis. So, any questions that I provide for you are questions that I have designed based on the current guidelines being tested on the ANCC as well as AAMP right now, right? And any videos that I am teaching on topics during the time that I'm teaching, if it's something that I say that is how we conduct and treat in practice, I will say that so that there's no confusion, okay? So just keep that in mind as we go through the material or if you're watching any of my videos on content. Well, with that being said, let's get into question number one for today, you guys. So, question number one states a patient presents to the office with complaints of stiffness in the morning for brief periods. She states that the more active she is, the more pain she notices. Based on the patient's complaints, what is the best differential diagnosis? Is it A, rheumatoid arthritis, B, gout, C, osteoarthritis, or D, a meniscal tear? Take a moment and tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first so that you can slow down and you can ensure that you're answering what they're even asking you, right? So here the stem of the question states, based on the patient's complaints, what is the best differential diagnosis? And you already know. If like I tell you, assessment, diagnosis, evaluation, treatment. So if we are looking for the diagnosis, you got to run it back and see what the assessment is, right? So, all right. So, how did the patient? What are their complaints? What are those subjective findings? Right. So, the patient's complaining that she has stiffness in the morning for brief periods. Okay. She says that the more active she is, she notices more pain. Right. Okay. So, when you think of something, and as I always tell you, know those key terms, identifiers, descriptions. Make sure you know it. When I say this, you say that. That's my my little way of telling you. But one thing that's a key, I should say, right here is that stiffness in the morning for brief periods. That's classic for osteoarthritis, right? Yeah, see, osteoarthritis. And then the more active she is, the more pain she notices. So let's think about it. So osteoarthritis, also known as degenerative joint disease, right? It worsens over time, but it's more like that wear and tear on the joints. So when you are more active, those joints are going to hurt you because they have more wear and tear. The cartilage is destroyed or damaged due to wear and tear, right? So when you use it, those joints, you're going to have more noted pain. And then when you rest and those inflamed joints are just still, they're stiff. So when they first wake up for a brief period, those joints feel stiff in the morning. And then when they kind of move, it loosens up the joint. Okay? So classic identification of osteoarthritis. Stiffness in the morning for brief periods. And then they note pain when they're more active or right after they just completed activity. Okay? All right, question number two. The nurse practitioner and NP student are discussing delayed puberty. What response is an appropriate response of delayed puberty for a young girl? Is it A, girls that have not reached Tanner stage 2 by the age of 14? Is it B, girls that have not reached Tanner stage 2 by the age of 12? Is it C, girls that have not reached Tanner stage 3 by the age of 14? Or D, girls that have not reached Tanner stage 3 by the age of 12? Take a moment and tell me what you got in the comments. All right, so the stem of the question states, What response is an appropriate response of delayed puberty for a young girl? So you have to know your Tanner stages when we are looking at our pediatric section for girls and boys, right? But for delayed puberty, delayed puberty, they haven't reached a certain um, maturity age and uh, growth production at a certain age, right? So um, you need to know girls versus boys. So is it A, girls that have not reached Tanner stage by the age, Tanner stage 2 by the age of 14? No. Girls that have not reached Tanner stage 2 by the age of 12? Yes. B is your answer. For delayed puberty, girls that have not reached Tanner stage 2 by the age of 12, and it's for the boys is by age 14. So girls that have not reached Tanner stage 2, where it is breast bud forming and the sparse pubic hair by the age of 12 is considered delayed puberty. And then boys that have not reached Tanner stage 2 by the age 14 is considered delayed puberty. Okay? All right, and lastly, question number 3 for today. The nurse practitioner and the NP student are discussing the difference between herbedens nodes and bouchards nodes. Based on the NP student's description of bouchards nodes, what shows an appropriate response? Is it A, located at the proximal interphalangeal joint, B, located at the distal interphalangeal joint, C, a node proximal to the carpal bones, or D, a node distal to the carpal bones? Take a moment to know what you got in the comments. All right, so STEM of the question states, based on the MP student's description of Bouchard's nodes, what shows an appropriate response? All right, so y'all are familiar with Herbedens and Bouchard's nodes, right? And I like to show images because even though you know it sometimes, I'm big on don't just learn the description, look at the word, look at the description, how it presents, but Google an image so that you can see it and you can apply it better and retain it better. That is my key recommendation, especially with any derm disorders, but things like this that visually know. I feel like if I can see it and what it looks like, and then I can identify that on my hand, then it's easier for me to retain, right? So, and there's so many sayings with it. But for Bouchard's nose are A, located at the proximal interphalangeal joint. So, and I put it in here like this because a lot of you guys, I know it's a saying. It's like HD, like HDTP, but HD and BP, right? And so BP for Bouchard's is proximal, HD for Herberdens is distal. Well, you need to know proximal to what. Don't just remember proximal. Because if they throw in anything with the word proximal, you're going to get confused and have to differentiate or guess between those, right? So it is proximal to the interphalangeal joint. Herbedens is distal to the interphalangeal joint. Look at a picture of it. Um, I usually show a picture in my classes. If I'll do a post on a picture, I'll have to make a note and do that one day to kind of just show you um, so you can visualize it as well. But Google it too and tell me if you start to retain it. But anyway, I hope you found this helpful, you guys. We'll continue doing our questions. I wanted to kind of hit some different areas, and some of these questions you'll note that I put them in a knowledge-based format, and I do it for a reason. And any of y'all who do like my custom courses, and I'm big on my drills and things like this, I format these things not only to test your knowledge, but to build your knowledge and to build that muscle memory to get you on certain tier levels. So, you'll see me asking questions, but then you'll see it that I'm asking to identify certain levels, because just like I'm telling you to study in that assessment, diagnosis, evaluation, and treatment, and I'm telling you that's how they test on it, I'm testing you in those areas as well. So even when some things seem like, oh, Brittany, that is so simple. It seems simple, but there's a method to my madness, and I am testing you in those areas, but building your memory in those areas as well. So just a study tactic to help y'all with your exam success. Okay. But anyway, you guys, you know the routine. Don't forget to like, comment, and subscribe and share with whomever you may find this beneficial as well. But make sure y'all come on back and meet me back here, right? And if y'all need me and need any of our services to help you with your studying, either if you're in school or preparing for boards, we offer review courses. There's self-paced courses that you complete on your own online. Um, we do 5-week courses, but enrollment is closed for that because that starts in a few days. We have one-on-one sessions that is geared to what you need. So either if you have a weak area that you need assistance with, making stronger. So if you're struggling with osteoarthritis and herbedens, etc., whatever the topic may be, we will work on that so that you can build that skill and be able to apply it to be successful on your exams and practice. The most common one-on-one that most people do is the custom package where we gauge your exam readiness, see where you really are right now, and design a package to help you prepare and study to go from unsuccessful to successful on boards. But whatever it is that you're looking for, our review book, just contact the Nursing Studio at 803-400-6864 or shoot us an email at thenursingstudio, the number 1 at gmail.com. I've also put links in the bio to make it a little bit easier for y'all to access. But make sure y'all meet me back here. Happy studying. Bye, y'all.